I'm absolutely delighted to be here. It's a great honour to be in Birmingham for this Patient Experience Network National Awards. I want to say 7 things briefly and then engage in a conversation with you. The first thing to say is that the work that PENA does is absolutely brilliant, because what it does is reflect the lived experience of key workers in our health and public services. And it reflects lived experience and good practitioner exchange, which is essential if we're going to move forward. Secondly, there is, I hope you agree, an essential change management principle that leadership has to be collective. It's not about the person at the top setting out what they think regardless of what the people who work with them think. It's about an organic development, drawing on the experience of the organisation, not just speaking for yourself. And so the organisation needs to reflect the organisation needs to reflect the leader, and the leader needs to reflect the organisation if it's going to work, and there needs to be that symmetry. Now, as National Ombudsman, my job is to speak truth unto power. I receive, not personally, but we receive 125,000 inquiries every year. We get 30,000 complaints. And in the post-COVID situation, demand is on the rise. So there are more and more complaints. There are not less of them as there were immediately after COVID. And my job in law is to see if there is evidence for poor service, inappropriate care, including clinical care, and if it's justified, to call the service to account by giving redress to the complainant and changing their policies and their operations. And in the last few years, as you well know, and especially in the last 12 months, I have been especially inundated and concerned and spoken about publicly the culture of the NHS, which puts, in some respects, organisational reputation above patient safety. And it's my job to call that out. But the danger for the Ombudsman is in pointing out these unacceptable behaviours. It's not to recognise the fantastic work which is carried out by the committed and principled and skilled professionals who operate the health service on a daily basis across many trusts and outside trusts as well. And you represent that goodness without which the health service would not carry the trust of the public. So I have to be balanced in my approach, recognising that it's only people who have a complaint that reach to me, but there is a lot of good work going on outside. Now, the PHSO-led NHS complaint standards has been many years in the making. I'm coming to the end of my term as Ombudsman, but we started this 6 years ago in researching what complaints handling was like in the public service and seeing that there was no common view about it, that people felt they needed support and training to do their job better, and they also felt that their leaders were leaving them alone when things turned bad and left them to carry the can for things that should be a collective responsibility. So we laid our research before Parliament, and then we undertook, together with you, pilot projects to see if we could get common standards for handling complaints on the front line. And we did this through engaging with around 70 frontline bodies, trusts, to work with them, the word you've used before, to co-produce the standards that should be used so we could listen more effectively to patients and their families and expedite their problems before they became worse and longer. And as a result of that pilot, which took place over a year, we developed a model complaints handling guide. We developed training for those who have to operate complaints, and we created networks where people could exchange what is a very difficult task of doing this business of complaints handling. And that has worked so well that it has now become fully operational across the NHS and wider than the NHS, so government departments have followed behind in adopting it and using it. And the key aim is to listen and address the issues brought by service users rather than fob them off in a way which sometimes, unfortunately, happens. And it not only applies to the NHS, we use it ourselves, because if we didn't do that, we could be accused of hypocrisy. My fifth point is that it is entirely fitting that we celebrate the critical development of the complaint standards with a new national award sponsored by the Health Service Ombudsman to celebrate the good practice which we've already found and which will be an opportunity to do that publicly. And this award, thanks to PEN, will be made for the first time in 2024. It will recognise any programme, any project, or even an initiative that has used the complaint standards framework and its supporting materials to improve the way that complaints are handled, providing a more positive experience for service users. My sixth point is this. Our aim, together, has to be to resolve as many complaints as possible on the front line as quickly as possible, rather than wait until they reach the Ombudsman. Objectively, I would like to see the Ombudsman receive half the number of cases we currently receive because they're being effectively resolved where they're occurring, to the satisfaction of both sides. But we know that that is a very difficult thing to achieve, and we have to do it realistically. We also know that the key issue is that we don't listen carefully enough to what patients have to say while they're being patients and when they're making complaints. And my 6 years has been littered with cases from the case of Robbie Powell, who died 30 years ago of undiagnosed Addison's disease in Wales, and he has never had a satisfactory account of what happened. And he's been seeking justice for the last 30 years, the last few of them with my support. And it's gone on, and you know the case of Merope Mills's daughter, who died of sepsis in part because she was not listened to by the people who were looking after her. So we have to be more effective at listening, and the complaint standards is one way of trying to resolve that issue. My very last point is this. I want to thank you for what you do. You have been through more than most people in any public service that I know of, and you have kept going. COVID, remote working, rising demand after COVID, serious staff shortages, stress, financial constraints, faulty buildings, and the impact of industrial action. You do a magnificent job under the most challenging circumstances, and it's entirely right that your profession and integrity should be celebrated here today. Thank you very much.
Yeah, hi Rob. Thanks for that, and I totally echo what you're saying about the NHS. I'm not a member of the NHS, but I absolutely love everything the NHS does and stands for. So, yeah, thank you as well from me. What my question is about people who don't have patient experiences. So the group that I kind of represent, because I'm neurodivergent myself, are neurodivergent people. And I go to lots and lots of meetings with people, and the only engagement some neurodivergent people have with health services is through 999 or emergency care. That their life experiences taking them up to adulthood have just meant that they totally disengage with any form of NHS service until it becomes at a critical point. And so, in terms of complaints and in terms of listening to and conversations around that, there just aren't any. And my passion, or what I'm championing for at the moment, is, like with people with learning disabilities, that we start thinking about a care pathway for neurodivergent people and developing that, of course, with neurodivergent people.
Thank you for that. And it's very sad to hear that. So I'm not asking the NHS to do anything that we as the Ombudsman haven't done. The key issue is not to sit in your building waiting for people to come to you. The key issue is to reach out, to seek to hear the views of people who wouldn't naturally come to you. And I know that the people who most need our services are the people who are least likely to come to us. So I have open meetings, I have consultations, I now have Ombudsman road shows where I've been to Darlington, to Stockton, to Bristol, to Northern Ireland, to try and meet people who wouldn't normally be able to come to me because they regard us as a bureaucratic part of the state, which we're not, but that's the view. And unless you reach out and try to listen and consult with people, then what you describe will continue to be a divide which is corrosive and unhelpful to both sides. We are enriched. I have Radio Ombudsman, this is a cheap plug, but it's worth it. Radio Ombudsman is a podcast which I have where there have been 30 episodes of talking to people who've had bad experiences from either my service or from the NHS. So you're giving a voice to people who wouldn't normally be able to articulate it. And the NHS has to do that too. It has a very difficult job, but it has to find a way of reaching out to the community and listening to what they have to say. Otherwise, you're going to get a situation like Birmingham, where yesterday we had a culture report published which showed that once they started engaging with their staff and outside, then they found they were entirely isolated and didn't understand what was going on. So an organic approach, connecting to people who wouldn't normally come to you, will pay off in the end.
Hi Rob, my name is Nick Hunt. I'm the Director of Patient Experience at Barts Health. We met briefly with your team when you came to Royal London. My question is about PSERF and how that links in with complaints. And the big shift that we're doing towards PSERF now, where we'll be sort of analyzing themes rather than addressing every single issue that comes up. In the short term, will that not have a big increase in the number of complaints coming in because patients might feel that they've sort of been left in the lurch? And I'm just wondering if you have any thoughts on how to deal with that.
Could you just tell people what PSERF is? It's the replacement serious investigation mechanism.
So PSERF is Patient Safety Incident Response Framework, which is where we will not be investigating every single issue that comes up or an incident that comes up, but rather sort of clubbing them into teams and trying to understand what they are. So some patients who feel that they've had an issue haven't been responded to.
It's a very good question, thank you, and I remember my visit and you very well. Look, there are serious issues here. We produced a report called Broken Trust in June of this year, where we found that under the old system of serious incident investigations by trust, in the last 3 years, we found 22 avoidable deaths in trusts where the trust using the same information as us, had found that there was nothing to concern them and no issue to be addressed. And we found avoidable death in each of those cases. So that is serious. It suggests that the system hasn't worked properly. And the new system is an opportunity to change that. But if you look at broken trust, we make a recommendation in there, or some recommendations, to do two things. It gives more discretion, as you say, to trusts about what they investigate and how they investigate. And we think there are two important additions that have to be made to this. First of all, there should be a board member with responsibility for looking specifically at those investigations to make sure they satisfy standards which would allow them to be considered competent. And secondly, there needs to be comparison between those trust investigations and what the CQC and the Ombudsman have to say. Because if there's a real disparity between those things, they're not credible. And in Birmingham and in other places, in Bristol, we have found that where there's been a trust investigation, too often it's been light touch, it hasn't really addressed the issues, and the trust has not been prepared to take for itself responsibility for what happened. I'd just like to say this by way of ending. This is not easy. No one's pretending it's easy, and don't expect to be thanked for it. I recently had a meeting with a complainant. He spent an hour and a half in my office, and at the end of it, he got up and he said, "Well, Mr. Behrens, before I met you, I thought you were a complete idiot. Now," he said, "I'm not so sure."